first step is that the patient will give us the request. So we have to see the laboratory request of the patient, and we have to make sure that there is a signature from his or her attending physician. There are some examples of the laboratory request, and this one is a vacant laboratory request. Second step is we have to call the patient's number. Usually in the laboratory, we give numbers so that we can accommodate them in the correct order. Next is greet the patient and identify the patient by having the patient verbally state his or her full name. Dapat sabihin niya yung buong pangalan niya. And confirm with the patient's unique address, age, and or birthday. And ensure the same information is on the request form. Dapat siguraduhin mo na magkamukha yung sinasabi ng pasyente sa iyo and dun sa nakalagay dun sa request form ng ating pasyente. Next is to verify that any dietary restrictions have been met. Example is fasting if appropriate. And check for latex sensitivity. So ito yung mahalaga, kung mayroon tayong mga test na nagre-require ng fasting, we should ask them if fasting sila, and we should also ask the hours kung ilang oras sila fasting. Kasi pwedeng ilang oras lang, 4, underfast sila, or overpass naman if like 14 hours, 15 hours. Dito, minsan, may mga pasyente na nagsisinungaling, and yun yung nagiging problema sa laboratory. It is also important to ask for latex allergies. If they have latex allergies, we can use tourniquet that don't contain latex. Number 1. What is your name?
Asnali,
When is your birthday?
October 60, 1994,
How old are you?
26,
Where do you live?
Anjo,
Are you fasting?
yes,
How many hours?
10 hours.
Okay, you can have your seat now. Don't have any allergies from latex?
No.
Assemble supplies and appropriate tubes for the requested test. Verify paperwork and tube selection. So dito kailangan natin mag-ingat. Laging tumingin sa request kung ano bang mga tube na kailangan. Dapat kumpleto yung tube. Kung kailangan mo ng yellow, ng EDTA, and then ng blue tube or citrate tube, dapat i-prepare mo siya ng kumpleto. Kasi if ever na may makalimutan kang tube, kailangan mo pala ng 3 tubes and 2 tubes lang yung lalagyan mo ng dugo. Nakaalis na si patient mo. So paano mo malalagyan ng dugo yung isa pang tube? First, I sanitize my hands. Then, I look at the request. CBC, lipid profile, creatinine, and blood grouping. So I need EDTA and yellow tube. I can also use the red tube, but I prefer to use the yellow tube. Then, prepare the materials. Alcohol pads, band-aids, gauze, and syringe. Because syringe lang yung ginagamit dito and walang evacuated system. Reassure and position the patient. If necessary, to help locate a vein, request that the patient clench his or her fist. Make sure na yung pag-clench ng fist is yung sakto lang. First, I ask the patient to close her fist, then I palpate the vein. So, ginagawa ko is tinitingnan ko kung asan yung location ng vein. Kung pa-straight ba siya, kung diagonal, kung sa left or sa right side. So, in case dito is visible yung vein niya. So, hindi mahirap kuhanan. As you can see, visible ang basilic vein and ang median cubital vein. So dahil ang ipa-priority natin lagi ay median vein, I will prefer the median vein. Apply the tourniquet and select an appropriate venipuncture site, giving priority to the median cubital or median vein. Ensure the tourniquet is on for no longer than 1 minute. Next is to put on our gloves, then cleanse the venipuncture site with 70% isopropyl alcohol. using concentric circles from the inside to the outside, or we also called it as aseptic technique. Then allow the skin to air dry. Take note na mahalaga yung aseptic technique dahil gusto nating matanggal yung dumi dun sa site. Inspect the equipment and needle tip for burrs and bends. Perform the venipuncture by anchoring the vein with the thumb 1 to 2 inches below the site and inserting the needle bevel up with an angle less than 30 degrees between the needle and the skin. So, kailangan is tingnan mo yung needle kung okay pa ba siya, and ako, yung barrel ng needle is tinitingnan ko talaga kasi minsan meron siyang air. So, i-push mo yun. Kailangan mo siya i-push kung may air siya. And sa pag-anchor naman, dapat 1 to 2 inches siya below the site. And always, sa pag-insert ng needle is bevel up. Release and remove the tourniquet as soon as blood flow is established or after no longer than 1 minute. Ensure that the patient's hand is open. Place gauze slightly over the puncture site without pressing down. Sa procedure na to, once na meron ng blood dun sa hub, then nakaka-extract ka na from the barrel, tell the patient to open his or her hand already. Then, if nandun ka na sa desired amount mo, which is like 5 ml, if 5 ml of syringe yung ginagamit mo, you should release the tourniquet. Then, put the gauze dun sa puncture site, pero wag mo pa siyang ipe-press muna dahil masasaktan yung patient mo. So, remove the needle. Then, that's the time that we will apply direct pressure to the puncture site using a clean gauze pad. Then, bandage the venipuncture site after checking to ensure that bleeding has stopped. So, maglalagay ka lang ng bandage kapag ang bleeding ay nag-stop na. So, apply the tourniquet on the desired arm. Yan. Dapat 2 inches above the desired location. After nating matalo yung tourniquet, it's our time to wear our gloves. Now is the time to do the aseptic technique. So we will clean the site from the inner to the outer part. Then while waiting for it to air dry, we will inspect the needle for burrs, bends, and if there's air that is introduced to the needle. Pull and push the plunger and make sure that there is no air inside the syringe. And now I am ready to insert the needle while anchoring the skin. Then may blood na, so I tell the patient to open her hand. Then hinihintay ko lang na makollect yung desired amount of blood. Then after obtaining the amount, ay tinanggal ko na yung tourniquet. Then lagyan ng gauze. Do not press it yet, then press it after you remove the needle. So kapag na-make sure nyo na nawala ng bleeding, so put the band-aid. Before umalis si patient, tanongin nyo muna siya kung okay ba yung pakiramdam niya. If a syringe has been used, fill the evacuated tubes and make sure that you fill it with the correct order of draw. Dispose the puncture equipment and other biohazardous waste. Label the tubes with the correct information. Do not forget that the label of the tube and that of the request are correct and should be exactly the same. So magre-recap na tayo ng needle using the fisheye technique. Yan. Then push it in a hard object or using the wall. Then tanggalin mo na yung pinaka-needle niya, then itapon mo siya dyan sa puncture-proof na lalagyan. Tapos ready mo na siya isalin. Sa pagsasalin naman, make sure na yung evacuated tube siya yung naka-diagonal and the syringe siya yung nasa straight. So gagamitin mo yung measurement ng syringe. Yan. So next naman is EDTA. So, bakit inuna natin yung yellow tube before yung EDTA? Kasi yung EDTA, di ba, meron siyang potassium. So, ipuunahin mo yung EDTA kaysa sa yellow tube, and then yung patient mo is may test na potassium, possibly makakontaminate ng potassium yung yellow tube natin. Convert mo yung EDTA 8 times. Then it is the time to put the name now. So sa name, put the name first, and then the date of birth, the age, and then the time of collection. Date and time of collection. Last is tingnan mo ulit yung request and then the label, check it if it's correct. Then dispose mo na yung mga nagamit mong kalat. So infectious tsaka non-infectious. Then if may time ka, i-disinfect mo yung area. Yan. And then tapos na yung ating Venipuncture.